Body and Soul.
938 Live.
Welcome back into Body and Soul on 938 Live, your daily health check. Daniel Martin here. We're continuing our ongoing chlorella series, and in this next segment, we want to find out more about the role that chlorella can play as you change elements of your diet when you're dealing with diabetes mellitus. We know that a lot of things has to be done in your body. Medication obviously forms a major part of your management. Diet changes, exercise, all to lower the blood pressure, to strengthen your heart functions and reduce those body fat and body weight issues, of course. What about chlorella and how it can contribute to your diet? Let's find out more. My guest on the program, Associate Professor Harish Kumar Kantilal from the Faculty of Medicine at Masa University College in KL, Malaysia. This edition of Body and Soul is brought to you by Abel D'Or Chlorella. For more information, please call 6339 5045. That's 6339 5045. Dr. Harish, we were just talking about the role that chlorella has to play, and you were likening and associating it to, just like eating another vegetable, but this vegetable is really power-packed in its ability to fight off the alkalinity in your body, rather the acidity in your body if you're diabetic, and of course the wonderful ability to fight off free radicals. I want to talk about something that you've been explaining to me, PPARs. What are PPARs, and how do these actually play a role with diabetes management?
Okay, basically PPAR is actually the acronym for Peroxisome Proliferatase Activated Receptor. Okay, now chlorella contains all the three types of PPAR, namely the alpha, beta, and also the gamma. Now basically what are these PPAR? They are actually, sorry to be technical here, but they are actually ligand activated nuclear transcription factors.
Oh, that's a mouthful.
Okay, so it's a very big word. Now basically in simple terms, okay, basically what does this PPAR do? They actually modulate the expression, okay, of an array of genes that actually play a central role in regulating glucose, lipid, and also cholesterol metabolism. So you can just imagine, once the genes, okay, that control glucose, lipid, okay, and cholesterol, they are all modulated correctly, automatically, okay, the sugar level and the cholesterol level will start coming into balance.
Does that mean that somebody with diabetes, those are obviously out of whack, they're not functioning properly?
Basically what happens, yes, when there's diabetes, okay, yes, there's a slight what do you call, the management of glucose, okay, is not very good, okay, the genes are not expressed well,
right?
So basically so what happens here is the sugar level is going up, little y is going down, okay, so there's no control. So once, okay, these PPARs, okay, what happens is chlorella contains this PPAR. Once they are actually agonist means they go and bind, okay, they bind, and what they do actually is they modulate the expression of these genes, okay, that they can control. That these genes actually play a very important role in controlling sugar levels, lipid levels, and cholesterol levels. So automatically what happens is, number one, the sugar level comes under control, and unknowingly at the same time the cholesterol levels also slowly come under control.
Right.
And this can have a positive effect, because this can prevent, okay, so many, okay, things, like can prevent even people who are healthy, they don't realize that actually by consuming chlorella on a daily basis, they're actually preventing metabolic syndromes, okay, such as heart disease, diabetes mellitus, obesity, and also hypercholesterolemia.
Wow, so by helping it to regulate those functions, once again, you're bringing things back to sync, really, to status quo.
Yeah, you're harmonizing. Yes, you're harmonizing the body, actually.
Right. Of course, it's no effect if you're doing that and then you're still going for your chili crab in the night and you're eating your platefuls of rice. That's not effectful.
Exactly. So I always tell people, you enjoy 80% in life. There must be, okay, 20% you must take care. Okay,
yes, of course.
You must have the thing. You cannot just take things and then you expect miracles to happen overnight. No, there must be some sort of discipline. Very important.
Let's go to the phone lines right now and take some questions. Jay is joining us right now. Jay, hi.
Yeah, how are you?
Very good, thank you. What is your question for us, Jay?
Yeah, I got two questions. One is, what are some food sources high in magnesium? And secondly, is there a link between an acidic body and premature aging?
Okay, thank you very much for those questions. We did mention some of these things earlier on, so maybe it's a bit sidetracky, but we'll address it to Dr. Harish right now. What are some other foods which are rich in magnesium as
Very
well?
simple. Anything which is green in color will be rich in magnesium because
Ah.
chlorophyll is the main thing which has got lots and lots of magnesium.
Right.
Now, coming back to your second question, Jay, is a very interesting question.
Anti-aging.
Actually, that is one of the things that I'll be talking about later about chlorella.
Yes.
Chlorella has got one benefit, which is anti-aging. Okay, normally people who consume, normally the more acidic your body is, you will start aging faster, definitely, because there's a lot of free radicals in your body. Okay, you will age faster. So by consuming chlorella, which will be one of my talks, okay, later, okay, definitely there's an anti-aging effect. You can see that the person will age much more gracefully because your body goes into a stage of alkaline.
You know, you also mentioned about the PPARs and how it's actually binding to certain genes in the body. So does that mean that chlorella is actually working on a genetic level?
Exactly, it goes to it helps the expression of the genes.
The
Okay, it helps
expression.
the expression of the genes.
And are many foods able to do this?
They have, but they may not have all the three types of PPARs, alpha, beta, and gamma. Here we have all the three types of PPARs.
That's right. So that is what really makes it quite unique. I want to talk to you about some of the studies that might have been done about this, but right now we're going to take some more calls and questions. Mona is joining us. Hi, Mona.
Hi, good morning, Daniel and Dr. Harish again. Doctor, I now know from you that chlorella has a high percentage of chlorophyll and it has photosynthetic characteristic like plants. But at the other extreme, the Chinese brown mushroom, it has no chlorophyll at all. But it's a rich vitamin D food and it's also essential in a weight loss diet. Why is it, Doctor?
Okay, well, I'm not sure if we know enough about the brown mushroom, unfortunately, right now. Dr. Harish?
No, because that works on a different, because the main content there is vitamin D.
Ah.
Okay, but you do not have the chlorophyll part of it. Now, of course it may have its own beneficial properties, but what is interesting in chlorella and why it helps in weight loss, okay, because that is actually sidetrack a bit.
Yeah.
Now, basically, why it helps is because once a person, okay, consumes chlorella, the person won't be craving for a lot of carbohydrate, which is the main reason why people put on weight.
Because it's regulating your sugar output levels.
Your sugar output level. So automatically your body goes into a harmonious stage, okay, where the sugar level is under control. So there's no cravings of carbohydrates. Okay. So people who take chlorella, they always tell me one thing, that their satiety level is better. They feel fuller for a longer time. They don't crave for all the sugar and chocolates and everything.
Right. I should do a whole show on cravings. People don't realize that cravings sometimes are programmed into your body.
Exactly.
Because
normally
of the foods we've eaten.
Normally when you crave, that means you must remember that there is deficiency in your body. That's why you're craving.
That's a good way to remember it. So the next time you have a craving, you want to fight it, remember like what Dr. Harish says, perhaps there's a deficiency in your body, that's why you're craving it. So that's a good way to turn it away. We're going to find out more about chlorella and the management of diabetes in just a while. Stay with us on Body and Soul. Welcome back to Body and Soul, the tail end of our discussion today as we continue in our chlorella series right here on Body and Soul on 938 Live. We've learned so much about how it has a role to play, and we've even previewed a little bit of what's to come. Jay, one of our callers, actually talked about anti-aging. In the coming weeks, we're going to be talking about how this can contribute to the aging gracefully process, I like to say. The Associate Professor Harish Kumar Kantilal joins me. He's from the Faculty of Medicine at Masa University College in KL, Malaysia. He has a background in the areas of research in microbiology, medical science, and nutrition. Now's the time, the last chance really, to get your questions answered. 669-11938. Dr. Harish, we were talking about PPARs and what the role they have on a genetic level, really. Talk to me. I mean, have there been a lot of studies behind this that have proven the efficacy of it?
Of PPAR, yeah. Basically, what they have done is they found that the PPAR found in chlorella increases the insulin sensitivity, okay, in diabetic patients and diabetic rats, okay. So once insulin sensitivity increases, the tissues and the cells in the body becomes more sensitive to insulin. So that's where the sugar level will slowly start to reduce. Because remember, diabetes or pre-diabetes is actually a stage of insulin resistance, where the cells and tissues do not respond to insulin.
Wow. So if somebody was actually consuming a large amount of chlorella as part of their healthy lifestyle for many years, they could in effect hopefully try and turn back pre-diabetes at some level.
Exactly. So basically those even studies have shown that those who consume chlorella, okay, so if they're supposed to get diabetes at the age of 65, perhaps they may get it maybe about 10 to 15 years later. So basically what it does is, because it helps, okay, it helps in regulating sugar level. At the same time, okay, the PPARs has been shown to regulate directly the beta cell genes, which is the pancreas, the beta Langerhans cells in the pancreas,
Okay.
which are involved in glucose sensing, insulin secretion, and also insulin gene transcription.
Okay, so
it
why
works
is that
actu-
important, those three?
Because insulin is the main thing that controls sugar level.
That's right.
So once your insulin production, okay, your insulin production is healthy, once your glucose sensing is healthy, automatically the sugar level will be healthy.
I
Healthy
see,
levels.
indeed. And there have been many studies that show about the antioxidant properties of chlorella has a role to play in terms of diabetes as well.
Exactly, because you must remember chlorella is rich in beta carotene. Now,
Yeah.
beta carotene is very important for the eyes. It's a provitamin A, and people with diabetes always have retinopathy, which is complications of the eyes. Okay, and then they have a lot of vitamin E. Now, vitamin E again is an antioxidant which works very well in places where there's a lot of fats, especially in the membranes. Okay, the cell membrane is 75% lipid, which
Oh,
is fat.
okay.
Okay, and then the iron in chlorella helps in fatigue of the eye. Normally, diabetic patient, they always have problems with tiredness in the eyes. They always feel. Okay, so basically, there's so many studies done. Okay, to show, and in one particular study, chlorella was found to significantly reduce DNA damage, because our DNA is damaged by free radicals.
Yes.
Okay, and when there is damage, okay, due to free radicals, the malondialdehyde concentration in the blood will increase. So they have one particular study, they found out that chlorella reduced both DNA damage and also the free radical damage levels in streptozotocin induced diabetic rats compared to the control group.
Okay.
So there's quite a number of studies. If you type, if you go to the computer, you can find out, you can see a lot of studies where chlorella has actually helped, okay, in management of diabetes.
Yes,
mellitus.
it sounds like not only is it contributing in some levels to management, but also it's a very protective element to it as well.
It's both for management. Okay, people out there who have diabetes, okay, you can consume chlorella, okay, to manage your diabetes better. And of course, those who have not, I think we should work harder in protecting ourselves
Yeah.
from getting diabetes mellitus.
You were recently giving a forum this past Saturday at the Abeldor offices, and many people turned out to hear about diabetes and the role that chlorella has to play. And you were saying that one of the most common questions that emerged was, how safe is it to consume together with your medication? Should you stop your medication when doing it? We're not saying that this is taking the place of medication, though, is it?
No,
Not
you
at
should
all.
continue your medication.
Yeah.
Now, when you consume chlorella, you continue with the medication. And what you can do, you can start consuming chlorella probably at a low dosage. You can start with 3 a day, then slowly go to 5, 10. Okay, you can go right up to 30 tablets a day. Okay, but you have to start with a very low dosage because your body takes time to adapt to chlorella. Because some people have got healing crisis sometimes.
Yes, we talked about that
Okay, we
earlier.
talked about that earlier. So you can. So what you do, I suggest that you consume chlorella and your medication at different times. Have a gap of about 2 to 3 hours. Don't consume them together. Now, religiously take chlorella, continue your medication. Perhaps in the next subsequent visits, when you see your general practitioner, your doctor, your physician, he will say that, oh, you're doing well now. Your sugar level is under control. Your fasting glucose is better. Your HbA1c has improved. So I think I will reduce your medication. That is the correct way.
That's how we should. I mean, we're making the right changes to our diet and lifestyle.
Exactly.
And this is contributing to that. Jones, you had a question about safety and efficacy, I think, as well?
Yeah, I would like to check with you. What are the side effects or negative effects of chlorella?
Actually, Jones, there are no negative effects of chlorella. Okay, basically, and there are no side effects. So basically, I think I've spoken in some of my interviews before. What you have is actually a healing crisis. Okay, when you consume chlorella, some people go through a process called healing crisis, where the body, okay, because there's a lot of toxins and heavy metals which have all accumulated in your tissues and your fats. So all of this will start coming out because chlorella is a very powerful detoxification agent.
And that is part of the problems that you would feel initially.
Exactly. Initially, you'll feel that problem. Some people have diarrhea, constipation, rashes, and everything. So there's nothing. Just go on. Maybe you can reduce your consumption a bit, and then slowly this will go off. So it'll taper off on its own time. But you go on your consuming of chlorella. There are no side effects. Okay, there are no negative effects of chlorella. It's just healing crisis, which happens for a very short period of time.
Dr. Harish, thank you so much for your time today. My guest on the program is Associate Professor Harish Kumar Kantilal from the Faculty of Medicine at Masa University College in Malaysia. And this edition of Body and Soul is brought to you by Abeldor Chlorella. For more information, please call 6339 5045.